You're live now, Dr. Tsay.
Hi everyone, we're Ageless MD and we're doing our live session. Everybody's been seeing me do this online. Now I'm going to do it live. This is our Endolift procedure. And what you're seeing me doing is you're seeing me insert a little angel hair pasta size fiber optic cable. Like, this thing is literally the size of a hair. And it just tunnels underneath the skin. Is the most amazing technology, and it just melts the fat. That's what we're doing today. We're melting fat and we're tightening skin to really sculpt out the jawline and give a really nice defined jawline. So it requires several passes. I'm just underneath the skin. She's fully numb, and you can see the red dot. When I turn off the light, you can see the red dot. It is technically a laser. It's a 1470 nanometer wavelength laser that targets water and fat. So we are targeting the fat cells, which are destroyed. And once the fat cells are destroyed, as you know, it's called lipolysis. They don't come back.
The aesthetic Harwinder said, "Hey doc."
Hey, what time is it over there in your part of the world?
And then Marty_Ta said, "That's awesome. How long do the results last?"
Oh gosh, you know, these results last up to 2 or 3 years. So it's not quite a surgical result like a facelift, but in terms of duration, but the results are just insane. If you've been watching my before and after photos, you'll see the results are just mind-blowing for something that's so simple and non-surgical. You can hear, I don't know if you can hear or not, but I'm going to be quiet for a little bit so you can hear. There's actually sizzling, like pop, snap, roll, pop, like it's melting the fat cells. Smile through your teeth. Great, relax again.
And the skin effect said, "Is she sleeping?"
No. Are you sleeping? No. Nope, she's fully awake. We have local anesthesia. So I put lidocaine all over her face via injections. So yeah, I pretty much numb you entirely during the procedure. This is sculpting the jawline. We are taking out baby fat. We're taking out extra unwanted fat that's obscuring or blocking the jawline.
And then aesthetic_Harwinder said, "You are blasting."
It's blasting. It is blasting. The Endolift machine is blasting the fat cells. Yeah, I don't know if you guys can hear it or not, but it's quite satisfying to hear the crackling sounds. You okay? Are you feeling anything? No?
Go Flawless Now said, "This is so cool."
Go hard. Go flawless. Go hard. That's her name. Sorry.
You're right.
I know who that is.
And then Marty_Ta1 said, "When it wears off, does it occur gradually?"
When what wears off? I'm not sure if you mean the lidocaine. The lidocaine lasts a couple of hours. The results wearing off, yeah, it's a gradual. I mean, basically your body still ages. You know, there's nothing in aesthetics that will stop your aging, right? I mean, our body still undergoes aging. We try to fight it as much as we can. You know, we eat healthy, we live healthy lives, but our body still ages. That's our destiny. And so we just unwind the clock back a few years and just keep doing it over and over.
And the skin effect said, "How deep are you going under the skin?"
I'm going above the platysma. That's a great question. I'm above the platysma and I'm in the supraplatysmal fat. So I'm fairly superficial, but I'm way underneath the dermis. And again, we're trying to melt fat here, so we're trying to sculpt this jawline.
Aesthetic_Harwinder, how much centimeters apart are you inserting the fiber again?
I have like 1, 2, 3 different insertion points for the lower face here. We're going to slim her face, we're going to melt the jowl fat, and we're going to tighten and sculpt the jawline. So there's several points of insertion. I use a 22 gauge needle to make the insertion hole. And then this part, I'm right above the sternocleidomastoid. So a lot of times people have extra fat there, and that's why you can't see the jawline either. So when you melt the fat sternocleidomastoid area, that really causes the jawline to pop. For those injectors out there that are watching, if you've ever tried injecting Botox in that sternocleidomastoid, it really helps to pop too. If someone has a really prominent sternocleidomastoid, you can Botox or toxin that mastoid, sternocleidomastoid, shrink it and both sides, and you can reduce the bulk, and then their jawline pops. But here we're reducing the fat bulk, so we're using a different way.
Go Flawless Now said, does it also tighten the skin while it melts?
Absolutely. This is the most amazing skin tightening device out there. It's definitely more invasive than something like an RF microneedling, which is really simple to do. This is a little bit more involved, but honestly, I think that the downtime on this is actually, I think, even less than, like, say, threads.
And then aesthetic_Harwinder, how many shots in one track?
So I go by a total jowl count. So I'm counting the jowls and I'm mapping it out, and I go by jowl count, but I also go by tissue interaction. So if you look here, I'm gonna actually show you live. When I go like pinch here versus pinch here, this, I can barely pinch the skin versus there's a lot more laxity and give on her right side. And that's an instantaneous contraction. It's immediate. So I'm really happy about that. But some people that are not, that I'm not melting fat, it does tighten the skin. Does a very good job.
And then Candy Raj said, where on the body can you do this?
Oh, yay. Oh, yeah. Small size muffin top, you can do it on the upper arms. You can do it on the knees. You can do it on the abdomen. You can do it for, besides muffin top, you can do it for, you know, loose skin. And also buttocks for potholes. Or I call it potholes. They're indentations of cellulite. Dimples. You can see the red dots right there, and I fire the laser and it's going, and I just pull it back and it's smooth and nice and slow. And I do make several passes.
Okay, and the Skin Effect said, is this good for all Fitzpatrick?
Yeah, I've not had it on the tried skin type 6, but it should be. Probably be careful on someone that maybe, well, I wouldn't do someone maybe with melasma possibly. You gotta be careful because it is heat, it's thermal injury. But people don't usually have melasma on the jawline, so. Feel that jawline coming alive.
KM Sazan said, can you change the setting to just tighten if you don't want fat removed?
Absolutely, yeah, there's different settings. There's actually different settings for fat reduction and skin tightening. So it does both. The wonderful thing is that it does both. So many times you melt the fat and you leave loose skin. So it'll definitely melt the fat, cause lipolysis, and give that skin contraction. Smile and show your feet. Great, relax again.
And then Miss_Cassie said, is this done under local?
Yep, this is all local anesthesia. There's 2 miscents, lidocaine here. 2%, 1 or 2% lido with epinephrine. So 62 joules. Wow. If we have the initial photo up so I can see which side is bigger, so we can assess for symmetry. So just maybe later ask Arla to give a photo. So maybe we can reset the joule count. And oh, what number was 633. 633. Okay, so write that somewhere down, 633. I'm going to start on the neck. So I don't know if the camera is set up to see this on this side. Maybe you can shift the camera or we can pause and come back. But can you see?
Yeah.
Actually, maybe rotate a little bit over this way. Yeah, can you see now?
Yeah, I think you're good. And then aesthetic_Harwinder said 1470 nm, right?
1470 nanometers, correct.
Dr. Cervantes said, cool, I want to see the before and after.
So we're gonna post, but afterwards, they have a little bit of swelling, so you can't really see sometimes. But definitely we'll be posting the results once we get them back. The results you're gonna see within a couple of weeks, but then the results continue to show even through months 4 through 6. So at 4 months, it looks better than month 2. At 6 months, it looks better than month 4, etc., etc.
And aesthetic_Harwinder said, thank you, Dr. Tsay.
You guys are welcome.
Marty_Ta1, will this also help with necklines and wrinkles?
Yes, it does. Actually, we're mainly doing a lipolysis treatment right now with some skin tightening, but it does help with necklace lines as well. And better to probably combine that maybe with like PRF or PDO smooth threads or something like that. I always love combining procedures, different modalities.
And then the skin effect, will they be able to drive home after?
Absolutely. This is completely local anesthetic. She did not take any Xanax or Versed. And yeah, you can drive home right away. Great thing about this, the downtime is not even that bad. It's mild swelling at the most. Really, it's not even like moderate swelling, it's mild.
KM Sasan said, does it help with acne scars?
You know what? I haven't tried it yet. In fact, I'm looking for models, but yeah, there's I do a lot of acne scar treatments. Probably this distensible acne scar, the distensible box scar, those you can do. I wouldn't try to this with any like ice pick or any of those scars. Yeah, there is a doctor in Iran that has some unbelievable acne scar results using the Endolift. There's a different fiber she uses, and but yeah, I can't wait to start trying that. Are you feeling a little bit here? A little bit in the middle? A little bit here? Okay.
Dr. Cervantes said, how many sessions do you recommend?
For this, for skin tightening, usually just one. Maybe if they want another session, they can do another one. For fat melting, most people probably want to do like 1 or 2, most likely 2. And we're talking, you know, I mean, you do see a very significant result even with 1. I mean, some of the before and afters that are posted are just unbelievable. I'm right now in their submentum.
The skin effect says it looks like a big deal, but based on her answers, it seems chill.
Say that again?
It looks like a big deal, but based on your answers, it seems chill.
Yeah, it seems like a big deal because I got blue drapes. I am sterile, so I want to keep things sterile, but it's completely a non-surgical treatment. And again, this is not. If you compare it to FaceTite, Accutite, Renuvion, they use giant, large surgical cannulas to do the same thing. A lot of people ask me about those other treatments, and I'm like, well, yeah, they all work great, but I'm using an angel hair pasta. I mean, you can't get more non-invasive than that. I mean, there's no incision marks, there's no scars. The swelling is mild versus the other ones. The swelling is quite significant. So the downtime is pretty low compared to the other treatments. So this is a very non-invasive or non-surgical treatment.
Dan Aesthetic Medical, hey TJ, any risk of burning the skin or risk of PIH?
Well, Dan, well, you know, in the right hands, right? I mean, you have to be really careful what we do. Any energy device you can burn the skin, right? So you got to just know your layers. You got to know your technique. You got to just be in the right layer. Like if I were to come out and start going real superficial, subdermal, yeah, I'm gonna burn the skin, but I know exactly. And it's cool because the light, I don't know if you guys can see the light, but there's a red laser light that's guiding me. I know exactly what depth I'm in with a laser light right here. I don't know if you guys can see that laser light. And I know where it is, I know the depth, and I know how to guide that. So yeah, it's fairly low if you really are trained properly and you know your depth.
The Skin Effect said, are you deeper than microneedling?
That's a weird question, but because microneedling I can go different depth, but microneedling doesn't give energy. Radio frequency microneedling does, and you can go as deep as, you know, depending on the device you're using. If you Morpheus, you can go 6 to 7 millimeters. Silfirm does 4 millimeters, but again, the depth isn't the most important. The important is the energy delivery and how efficient that energy is being delivered. Oh, listen to that sound, that crackling, that popping.
Calf0812 said, wow, super cool.
Thank you. This is a cool machine.
Candy Raj said, can you do a brow lift with this?
We're not recommending to do brow lifts with this. We actually do really good brow lifts with our Silfir machine. So, and that's even more on it. That's a radio frequency microneedling. Yeah, there's certain nerves up there, the frontal branch, facial nerve, things like that, that you could probably nick on the way of the brow. But yeah, this is not recommended for brow lift. It's really best for the jawline sculpting. I swear it's probably the #1 thing out there.
Dr. Cervantes said, if the patient has threads after, how long can you use this device?
Well, you know, we're in the same depth layers of threads. So, you know, this laser, even though it's not targeting PDO, it can affect the threads. So I would recommend that people do the threads after they do this procedure. If not, you can do it several months, maybe 4 to 6 months after the thread procedure. But I'm actually going to be combining this with threads because the threads give more the vertical lift, whereas this is more like tightening, centripetal tightening, and the thread is a vertical, like getting more vertical lift. So it's gonna complement each other.
Can Cezanne says, shout out to that beautiful woman for letting us watch. Thank you.
Oh, that's so nice that you acknowledge the patient model. Yeah, we really appreciate her too. How's this? Is you okay here?
I need to swallow myself.
Yeah, of course. Go ahead. Okay?
Yep.
Yeah.
As long as you're
Better
getting
enough?
all that double chin away,
Yeah.
I'm good.
So I'll do left neck. We'll write the jowl count, and I'll do right neck.
Aesthetic _Harwinder said, shout out to the patient.
Yeah, that's really nice. You guys acknowledge because it is very you know, they're vulnerable. They're under this, you know, you guys, everybody's looking at their faces, and it's really nice to acknowledge that they're like offering to do this.
The Skin Effect said, with the energy, is it better because you're under the skin versus other machines?
Oh yeah, you're directly targeting the fat. I mean, the only way to get under the fat is to get under the fat. I mean, I don't know how else to say that, but like microneedling, you're getting under the fat, but you got to use the needles, and it's multiple needles. You can really access this by just tunneling underneath the skin.
Skin Effect said gotcha. Thank you.
You're welcome. So we'll probably pause, and then this is like, kind of get the gist of it. It's really a little bit tedious, but you know, we're just kind of going back and forth, and we'll probably pause and then come back and go live a little bit, and we'll go on the other side. So stay tuned if you guys want to come back and join. If not, we'll probably get a new crowd in another like 15-20 minutes.
Sorry, and before we go, Dr. Cervantes said, sorry, what's the name of the machine?
The name of the machine, Dr. Cervantes, is Endolift. E-N-D-O lift. And let me know if you're interested. They are based out of Italy. I don't know about your country, but yeah, it's actually very popular in Europe. I'm not sure about Spain, but I know you're in Spain.
Sorry, last question before we go. Hey Doc, can Sculptra lift face if placed near the back of the jaw?
Can Sculptra
Lift the face, yeah.
if placed?
Near the back of the jaw.
I would use something else besides Sculptra for the back of the jaw. I know you're talking about the ramus, posterior ramus of the mandible. You probably want to do like a high G prime filler. I mean, you put Sculptra there for shaping, sculpting, but I like to use a high G prime filler. Voluma, Wrestle and Lift are, you know, upcoming now that we have the new Volux. So I would prefer a high G prime filler for lifting.
Okay.
Thanks guys, I'll see you guys soon.